Whoa, are we live? Are we live? Man, this is kind of jacked up, I know. You guys may not like this, but you might like it. I'm really not sure. But so I want to check the CDC website. John Lee here doing a live video. So obviously, I'm new to doing live videos. And you're not used to seeing me doing a live video, so just bear with me. But feel free to comment or do whatever you'd like. I'll try to check back in on that every once in a while. Um, trying to see how I could get this. Maybe I could do it like that. I guess we could do it like that. And then if anybody cares to, we could look at something else. So I kind of wanted to talk about, let me shine a little bit of light on myself here. Oh, hell. You'd think I'd already have this part figured out, wouldn't you? Well, just goes to show you. So I'm not sure that these vaccines are even licensed COVID-19 vaccines. So if anybody knows anything about this, and I don't mean to sound like a conspiracy theorist or anything like that, but this shit is a conspiracy. I mean, it has to be. The push for control and just, authoritarianism is really gotten out of hand, and I'm sure I'm not the only person that thinks that. I think a lot of people think that. Son of a bitch. Not a whole lot of people on the YouTube on Sunday. I just wanted to point out a couple of facts. It is important to note again that although CDC's VIS code set files are used to convey the codes for EUA fact sheets for recipients and caregivers, these fact sheets are distinct from VISs. VISs will become available when there are licensed COVID-19 vaccines. So for me, just saying that your COVID-19 vaccines are not licensed, I just kind of blows my fucking mind. Now, why aren't more people talking about this shit? Is the vaccine safe? If you punch that in, vaccine safety and monitoring, really started making me wonder, like, are we actually monitoring where is the monitoring? Where is the data? So I'm on here to actually look for it myself and see if we can find it. Your vaccination types of the possible side effects. And it's important to me to try to understand where, the other side is coming from. I'm not anti-vax. I'm just anti, tyrant. I'm anti-dictator. I'm anti-socialism, anti-communism. So, which is pretty much everything opposite of the far left. And I really don't know why that is. But it is what it is. So, according to the CDC website, vaccine safety and monitoring, COVID-19 vaccines were developed using science that has been around for decades. Now, this really bothers me because I think that, the wording that the CDC is using is treason, and it's treachery, and it's very misleading, and I think that it's actually misinformation. So just because I use a car doesn't mean that I can't do something bad with something that would otherwise be deemed a normal, useful tool. You know what I'm saying? Like, just showing the emergency use authorization, 2 months of a study. You don't have information and tracking data on these vaccines because none of them are actually licensed vaccines. Getting the push and the rush from the FDA to get these rolled out to millions of people, none of these, is it true that none of these COVID-19 vaccines are licensed? I mean, how could you possibly manage to get millions of people to take something that's not even, stood the test of time? We don't know what the long-term effects are. And so, I think it's pretty crazy that people are just not paying any fucking attention to any of this whatsoever. COVID-19 vaccines are safe, much safer than getting COVID-19. Now, there's a big discussion about natural immunity, and I hold the belief, and I think that, my research has shown that people who have had COVID have a higher natural immunity and better protection than those who have actually been vaccinated. Now, I don't know that I need to necessarily quote a study. But I think that it's common knowledge. Why isn't that information here on the CDC website? If that's been proven, why isn't the CDC? Why are they so protective about the narrative? Why are they changing the wording of, different things? We funded the lab in Wuhan, but we didn't directly, we funded somebody and then they funded somebody who funded the Wuhan lab. Just because people can indirectly, to me, withholding information is really tiptoeing around lying. And I really do think that there's some shady corruption going on from, people in these high places, the people who's pushing the recommendations and leading these public health safety issues are now on the boards of these fucking vaccine manufacturers making millions of dollars. Now, that is just way too convenient, if you ask me. COVID-19 vaccines are effective at preventing severe illness from COVID-19 and limiting the spread of the virus that causes it. Millions of people in the United States have received COVID-19 vaccines under the most intense safety monitoring in U.S. history. CDC recommends you get a COVID-19 vaccine as soon as you can. But they didn't say anything about what we know about natural immunity. Is the vaccine safe? New ways to gather information about the vaccines. Web-based platforms give CDC scientists information about that in real time. You can use your smartphone. Here's a vaccine adverse reporting system. Let's see. You closely monitored for safety, yet you only fucking tested it for 2 months before rolling it out to millions of people. You're giving it, requiring it for pregnant women, pregnant mothers, when you don't even know at that time your tests only showed, first and second, trimester, and you didn't even really know. So how could you be recommending? You didn't know the long-term effects. At that time, they didn't know how babies were born. And so they didn't have any deaths during those periods. But it just all seems sketchy to me. And it has from the beginning. And if it's one thing I know, it's bullshit when I see it. And bullshit artists. Oh. I'm just wondering what vaccine safety experts review all reports of serious adverse events submitted to the VAERS. A serious adverse event after vaccination is something that causes permanent disability, hospitalization or an extended hospital stay if vaccinated while in the hospital, life-threatening illness, birth defects, or death. I mean, wow. That's what you got to have before they're reporting it. I mean, that's crazy. I mean, it just sounds too fucking risky, if you ask me. Possible side effects. See, I already feel like I've already shown. Oh, cases and data. I mean, you could be on this motherfucker for God only knows how long. Your community, county view. That's really not what I wanted to show you and really not what I wanted to get into. God damn it. I really wanted to get into, what kind of information do they have about the vaccines themselves and how safe they are. And then, what different vaccines are available? Let's just cover a couple of these. It says 3 COVID-19 vaccines are authorized or approved for use in the United States to prevent COVID-19. The Pfizer, the Moderna are preferred. You may get Johnson & Johnson vaccine in some situations. And here's a list of what they are. And through all of these, we don't have any proof or evidence that past like 5 months that these are even effective. And so, originally this was to eradicate the virus, and now that's not what we're looking at. So we've actually engineered this virus. We let China get away with pretty much destroying the entire world and basically no accountability there. We let Fauci get away with changing the rules of the game as we go along. Didn't say a word. We don't have a time of minutes of these major decisions and discussions that have been had that have been making these major decisions. Let's see, the booster dose, 18 and older should get a booster 5 months after the last dose. Also for Moderna, 5 months after last dose. Is it me or does this sound like something that somebody's trying to sell you? Like one of these big tech companies that are like, you got to buy this to get this and this and this. And they always got to make something for you to have to keep coming back and spending more money. Now, I know it's not just me. See what you need to know about the immune system. How COVID-19 vaccines work. I don't even give a shit anymore. I just feel like the process has been chopped, and for some reason, I just don't trust them. And that's why really I would direct you to that essay by Deutsch, Dr. Deutsch, on called Needle Points, because that really articulates it, start to finish, the beginning to end pandemic, possible side effects. That's what people want to know. People want to know that they can trust the people who's in charge of public health. If the public health officials don't trust the people, how can the people trust the public health officials? I mean, this is a no-brainer. And I was reading this earlier, and it was basically saying, pretty much just downplays it, acts like, bad stuff could still happen. You could still have allergic reactions, but, they downplay it into these cartoons that makes it look like, oh, it's really not that bad. You just get a little pain and swelling, adverse effects. Let's click on that. Are the vaccines safe? But I wish I knew where the and they just take you in fucking circles. Anaphylaxis after COVID-19 vaccination is rare and has occurred in approximately 5 people per 1 million vaccinated in the United States. The type of allergic reaction can occur after any kind of vaccination. If it happens, healthcare providers can effectively and immediately treat the reaction. Learn more about the COVID-19 vaccines and allergic reactions, including anaphylaxis. Thrombosis with thrombocytopenia syndrome after Johnson & Johnson's COVID-19 vaccination is rare. Caused blood clots. That's not good. Let's see. As of February 10th, 2022, more than 18.2 million doses of the Johnson & Johnson vaccine were given out. CDC and the FDA identified 57 confirmed reports of people who got the Johnson & Johnson COVID-19 vaccine and later developed the thrombosis with thrombocytopenia syndrome. So, how do you know if you're going to be the one that's going to get some of this fucked up shit? That's why they have long-term studies on these types of things before they're allowed to get licensed. So for them to say that they're actually using science that they've been using for decades, yes, they're using some of the science, but are they using the same methodology, or are they using this coercion, this, trying to make everybody afraid of everybody, trying to spread a fear of, oh my God, you could get this and you could, be responsible for the death of not only yourself, but the people you care about and your entire community, the country, and the world. They made it this huge global pandemic. But did they do it all for control? Did they do it for safety, or did they do it for control? They hit you where it counts. CDC has also identified 9 deaths that have been caused by or were directly attributed to that TTS from the Johnson & Johnson vaccination. Women ages 30 to 49 especially should be aware of the increased risk of this rare adverse event. There are other COVID-19 vaccine options available for which the risk has not been seen. So am I the only one that thinks that, these are fucked up fucking things to be seeing? To date, 3 confirmed cases of TTS following the mRNA COVID-19 vaccination Moderna have been reported to VAERS after more than 526 million doses of the vaccine were administered. Based on available data, there is not an increased risk for that after the mRNA COVID-19 vaccination. Oh, but that's not all. The Guillain-Barré syndrome in people who have received the Johnson & Johnson. It's also rare, but it has also happened. And all of this stuff is within like a year or two. You know what I mean? So we have no idea what could potentially develop down the road or potentially happen. You know what I'm saying? And they didn't care. That's how greedy these motherfucking pharmaceutical companies are, and how crooked some of these CEOs and people in the public health sector and people of power and political power. That's how dangerous these fucking people are, because they're dictating this corruption from the top down. And really, these motherfuckers have got to go. And the rest of us have got to pay attention to what the fuck is going on and get these motherfuckers out of there. I mean, look what they're doing to our kids, our country. It's ridiculous. I don't even know what GBS is. It says it's a rare disorder where the body's immune system damages nerve cells, causing muscle weakness and sometimes paralysis. Most people fully recover from GBS, but some have permanent nerve damage. After more than 18.2 million vaccines administered of Johnson & Johnson, there have been around 310 preliminary reports of GBS identified in VARES as of February 10th, 2022. These cases have largely been reported about 2 weeks after vaccination, and mostly in men, many of those ages 50 years and older. So why is it that you don't hear about this kind of shit? You know what I'm saying? Like, why don't you hear about it? Myocarditis and pericarditis, those I did hear about. They're rare, but fuck, you wouldn't want to be the person that shit happens to. You know what I'm saying? Inflammation of the heart muscle, and pericarditis is inflammation of the outer lining of the heart. Most patients with myocarditis and pericarditis after COVID-19 vaccination responded well to medicine and rest and felt better quickly. As of February 10th, 2022, the VAERS has received 2,239 preliminary reports of myocarditis or pericarditis among people ages 30 years and younger who received COVID-19 vaccines. Now, that's a lot of fucking people that are getting fucked up by these. And these fucking pharmaceutical companies are not being required to use the fucking scientific fucking standard that we have actually been using for decades. So to me, this is really pumping a lot of fucking misinformation, a lot of mistrust all around. You got to dig to find this type of information. They're not, telling you about this shit to the public. They're downplaying it. They're trying to cover it up. I mean, it's just a fucking mess. It's one mess after a fucking another. Most cases have been reported after receiving the Pfizer or Moderna, particularly in male adolescents and young adults. Through follow-up, including medical record reviews, CDC and FDA have verified 1,307 reports of myocarditis. Or is it myocarditis? Sorry. And you can learn more about that. Reports of death after COVID-19 vaccination are rare. The FDA requires healthcare providers to report any death after COVID-19 vaccination to VAERS, even if it's unclear whether the vaccine was the cause. Reports of adverse events to VAERS following vaccination, including deaths, do not necessarily mean that a vaccine caused a health problem. More than 547 million doses of COVID-19 vaccines were administered in the United States from December 14th, 2020 through February 14th, 2022. During this time, VAERS received 12,304 preliminary reports of death, 0.0022%, among people who received a COVID-19 vaccine. It still sounds like 12,304 people died, and it might have been because they were forced to take this fucking vaccine. People who received that. CDC and FDA clinicians review reports of deaths to VAERS, including death certificates, autopsy, and medical records. So all I'm trying to say is, how transparent is, the CDC? How transparent are these fucking pharmaceutical companies? We all know they're a bunch of fucking political crooks. When the fuck are we going to actually stop these fucking people from continuing to fucking warp the minds of our children and warp the fucking and cause the intense division between all parties and all people, all humans, one nation under God? United we stand, divided we fall. And here we go, baby. Here we go. I'm John Lee. If you like videos like these, be sure and hit that like and subscribe button for me. Let's start a dialogue. I mean, anybody that has something to say on this, please drop your comments below. I'm trying to open a dialogue about this. I want to have a conversation about why we should be doing things differently, why we shouldn't be rolling shit out on a 2 months worth of data and testing, why we should be more transparent, why we should be itemizing and keeping track of the minutes of these types of major decisions that are going to affect millions of people. Making sure that we've done our diligence and that we don't cause more problems. One of the main focuses of modern medicine is to not cause harm and not to treat people when it's not necessary. If people who have had COVID have better protection than those that have been vaccinated, we need to get that message out there. We at least need to be honest about it. We need to stop beating around the bush and basically telling everybody the shit that's a fucking lie, and quit downplaying shit. And at least you would gain the respect and the trust of the American people. I'm John Lee. Don't forget, hit that like and subscribe button for me. I'm off to the next one. We'll see you on the next go round, peeps. I'm out.